Alzheimer's disease is the perfect storm.
We'll find somehow the cause and cure for Alzheimer's.
Raindrops are falling on the city.
It affects me terribly, and I miss her terribly. She's not the same person anymore. And I guess, like in all Alzheimer's people, when you think back and say, my God, what a wonderful person, and now look what's happened.
Since my heart is with North Shore LIJ, I wanted to do it here. And so we have done so. And I think we've made great strides.
Like we once used to be.
You know, come on, let's go. That's the feeling right now, is, you know, we just can't wait to get it done.
The Feinstein Institute for Medical Research is a place where research meets the patient.
I'm Leonard Litwin. I've been around for a long time. At the present time, I'm 92 years old. My wife has Alzheimer's. She has had Alzheimer's for about 12, 14 years already. This was a woman who was quite brilliant, vivacious, beautiful, full of life. This vivacious, beautiful woman is now like a 10-year-old child. One of the reasons, of course, why I'm so interested in Alzheimer's research is because of the fact that my wife has Alzheimer's. I also have 2 daughters, which makes me somewhat nervous too, because Alzheimer's happens to be hereditary. Since Alzheimer's is a hereditary disease, a good friend of mine, Donald Zucker, and myself had a meeting. Donald's mother died from Alzheimer's. My wife has Alzheimer's. I'm concerned about my children. We decided to create a research center, and we finally put funds together here at North Shore, and we created the Litwin Zucker Research Center for Alzheimer's disease.
I like to do things in an area that I really believe need to be done the most. That's why I did the psychiatric hospital. That's why I do a lot of the things that we do personally in the philanthropic world. And the world of Alzheimer's is so dark as far as knowledge is concerned, and it is so pervasive as far as the number of people who have been affected and afflicted by Alzheimer's, that I really felt very strongly that I wanted to see if I could help do something to alleviate the problem and to find out actually what causes Alzheimer's, and perhaps be able to find out how to treat it and maybe stop it from occurring. And that's obviously basic research, and although there is a lot of it being done, there wasn't a lot of it being done in this area. And since my heart is with North Shore LIJ, I wanted to do it here. And so we have done so. And I think we've made great strides. Peter Davis is incredible, and we have great hopes for what's happening now.
Alzheimer's disease is the perfect storm. It's an accident waiting to happen. There are going to be, as I'm sure you may know, 64 million Americans, minimally, who are going to turn 85 at about the same time. And the actuaries tell us that half of those individuals will live to be 85 or older, and half again will have Alzheimer's disease. 16 million Americans. And what we now know is that we'll have about 1 in 5 New Yorkers in that period who either have Alzheimer's disease or are taking care of someone who does, and the impact on the community will be extraordinary. But even in this extraordinary place, there are some that rise above the others. Peter is a wonderful scientist, innovative, intelligent, well-respected by his peers. Peter is, without question, one of the top researchers throughout the country, throughout the world, in Alzheimer's disease research.
I've worked in this disease 30 years and been trying to put together the pieces of the puzzle. We were involved 25 years ago in the work that led to the development of the currently approved drugs for Alzheimer's. That comes out of the basic research we did years ago now. But really 2 years ago, actually it was the summer of 2004, I realized that the pieces could fit together. All the disparate papers in research begin to come together, begin to make some sense. You know, I came to the Feinstein in 2006 because it's time. It's time to move the science from the lab into the patient. And that's a big undertaking, you know, and it needs the kind of diverse talent that's here at Feinstein. And I think research as a whole, and our own research too, has really, it's left us in a place where we think we understand exactly what's going on in the brain of a patient with Alzheimer's disease, exactly what's gone wrong. And if we're correct about that, then the ways to stop that are not that hard. The drugs that we need to develop to stop the process of the disease are not some terribly difficult stem cell or biological approach. They're simple chemical compounds that would have a specific activity, should stop this disease cold. I mean, I'm burning with the desire to test that idea, to find out if we're really correct. Because if we are, then we'll have drugs that will simple, hopefully pretty safe drugs that will stop the process. We know the kind of patients we want to treat, people who are quite early in the disease. We're developing ways to identify those patients. We're developing the drugs. You know, come on, let's go. That's the feeling right now is, you know, we just can't wait to get it done.
The Feinstein Institute for Medical Research is a place where research meets the patient. Here we have scientists and investigators who work on figuring out what causes diseases and the best way to take this new knowledge about diseases and make new treatments. We have tremendous expertise in a number of common diseases, including rheumatoid arthritis, lupus, psychiatric disorders, Alzheimer's disease, of course. Philosophy for the growth and expansion of the Feinstein, and that's to identify the best people in their fields who are committed to finding new ways of curing disease and bringing them here in a collaborative and interactive way. My vision of the future for the Feinstein Institute is that it will prove to be the home of a discovery that cures a disease.
Now I think that we've just been moving ahead at warp speed. I mean, this research institute is just amazing. I mean, we've created an environment where scientists are excited about working here, and they feel they can think out of the box, they can collaborate with each other. They're at a place where the science meets the patient. There's hardly anybody else doing that. These scientists are world-class scientists that are joining the Institute on an ongoing basis, and I think we're going to have a worldwide reputation, and we wanted to be on board for that. We wanted to try to help make that happen, and we really thank all of you for being here today and participating and also helping us to make that happen.
We hopefully, for my benefit, for my children's benefit, and for many of you folks out there, your benefit too, we'll find somehow the cause and cure for Alzheimer's.
From a clinical point of view, in addition to the research part that we've been doing, we've established a clinic which at this point has 300 to 400 patients, all who are in some way or another afflicted or believe they will be afflicted with Alzheimer's. And they are ready to be guinea pigs in any way, shape, or form to try to help themselves. And it's very important to have this clinical part to go with our research part. And they really work hand in hand. And it helps in the final analysis to come to what we want to find.